Thank you so much, Ashwin, for this wonderful introduction. So I will be just talking. Ashwin wanted me to cover up iris repair management during cataract surgery. So I will be covering up those. So briefly now, when we consider whenever we want to do an iris repair, it is usually two types of method that we have for repair. The first one is the pupil-centric method. That is where you try to create a pupil with appropriate centration. The second thing that we usually do with the irises is that, we need to do the iris-based repair, and that is what we call it as an iridodialysis repair. So these are basically the two major kind of iris repair procedures. And then comes in more complicated cases, then we go ahead with the combination of both these that is applied clinically. So first, I will just highlight the pupil-centric method, and that is the single-pass 4-through pupiloplasty procedure, which we are now using commonly. This is the animation of the video that showcases how this procedure is done. We use a 9-0 polypropylene suture. It's a long arm needle, which is passed from the proximal end of the iris tissue, goes from the distal end, and you just go through the side port. You create a suture loop, pull this suture loop out, and the end of the suture is passed through the loop 4 times. 4 times is the most important aspect of doing a single pass 4-through, because that is where the suture holds onto it, and you do not have to redo the procedure. You do not have to take the second throw for this surgical procedure. So that is how it derives its name as single pass 4-through pupiloplasty procedure. Now, when you apply it clinically, I will just try to show you cataract surgery, which has been done. The lens fixation has already been done in this case. And now this is the clinical application of the single pass 4-through pupiloplasty procedure. Having passed from the proximal end, now what you see is that the distal end of the iris tissue that is to be approximated is whole. Now, at this stage, you have 2 options. Either you can pass the needle directly from the distal end and pull it out, or you can also railroad it with the 26 gauge needle, and then you can go ahead with the surgical procedure. Creation of this loop is very important. Through this loop, the suture end has to be passed 4 times in the same direction. You do not have to change the direction. Otherwise, what it happens, it undoes the procedure that you are doing. Your throws will be less. If you go ahead with either a 3 or a 2 loop, it is going to open up and you have to take a second pass. So if you just want to end up this procedure with a single pass, you just have to take full 4 throws, because in the lab study, we have found that 4 throws are the most optimal kind of thing. It will stay back even if you take a 5 or 6 throw, but that adds to the bulk of the suture material which is there inside the eye. You can repeat this procedure till you have the iris defect totally covered up. So this procedure actually it works very beautifully, because you just have a single pass. There is less manipulation for any one single side that you need to approximate in the iris tissue. Just a single pass works very well through that. So there is a minimal intraocular manipulation, and definitely that translates into lesser inflammation in the postoperative period. So this is one of the pupil-centric method, which we call this as the single pass 4-through pupiloplasty procedure. Now we go ahead to the second thing, and that's the iris repair. Now this is a modified sewing machine. This surgery I have just done a few days back last week. So I thought, let me edit this and let me show it to you. Have a look here. We have the iridodialysis, and it's quite big. So before we take up this case for a cataract surgery, I first like to do a cataract. Because when I do the cataract surgery, I'm just decompressing the anterior chamber, and then we go ahead with the iris repair procedure. So just that the iris tissue does not fall back when you're doing a cataract surgery, you need to retract the iris tissue from there, and that's why the iris hooks are used. I would always say that iris hooks have to be used. They are best because it's an external fixating device, and rings I do not usually recommend in these cases, because these are usually complicated cases, and hooks, they work really very well. Now this is the animation of modified sewing machine technique. I just paused this here. What you are seeing here is this is a 26 gauge needle which has been threaded with the suture, with the same 9 polypropylene suture. It has been threaded. Now this works as we create multiple loops out here. Now there are 2 methods. One is the sewing machine technique, and one is the modified sewing machine technique. In the sewing, this is the modified version, wherein the one end of the suture is passed through all the loops, and then it is tied with the last loop, so that you finish up the entire procedure with just one. Just once you have to take a knot here, and your entire thing is done. You can even do a modified version. Sorry, not a modified version, but you can even do a simple sewing machine. But there, you have to cut down those loops and keep on suturing one with the other. So in order to avoid multiple suturing, you can do this. Now you just have a look. This is a clinical application here. This is the needle which I'm just threading with the suture. And so you are just ready now to do the procedure. So you just do a conjunctival peritomy, you create a scleral groove all across the area where iridodialysis repair has to be done. So having done, because we are going to pass on the suture into this groove and we are going to bury it inside. So now this is the threaded needle. This threaded needle comes out from that groove, and you just have this loop. So you just pull this, and now you'll have a loop, but just because this is the first suture that you are taking, you will get one end free. So you just pull that out, and then you keep on creating multiple loops. You go back inside, take the adjacent iris tissue, come out from the groove, just pull this again. So you have one loop out here, again go back inside, and again you engage the adjacent iris tissue, and you keep on doing till you have the entire iridodialysis area covered up. One important thing while doing a sewing machine is what I learned from my personal experience is that, when you're going ahead for the second loop, you have to be very careful that, when you are, your previous loops, they don't slip back inside, because there is a tendency, because all these sutures are interconnected with one another. So when you go for the second loop, there is a chance that you might slip on. Now see, this suture has slipped on. If you noticed what happened just now, this thing I did not realize intraoperatively. I realized it when I was editing the video that, madam, I just had one slippage of loop inside, which I did not even realize that it had happened. It did not matter much in the surgical outcome, because actually everything is interconnected. So once you pull this loop, it stays back, and they're interconnected. So it's going to remain in place. So that's not an issue, but that area just went off. So after that, I was very careful, taking care of all the loops that had come out. And you need to pull out much more of it from the section area, so that, even if it slips a little bit, you can just pull them out again. Then you have to be careful when you're taking the last thing also. And then when you have the entire thing out, you just have to pass the suture end through one loop. This I'm just forwarding the video here. You pass from the second, third, fourth loop. And then as I showed in the animation, you just end up tying all the sutures, and you're all done for this. The second most important thing is, when you're doing any iridodialysis repair, is the calibration of the tension that you are putting on the iris tissue. That's very essential, because if you tend to pull up too much, it can cause retraction of the iris. Now, I had a bit of retraction here. It can happen because of two ways. Either you have engaged too much of iris tissue in the needle, that pulls it out, or what actually happened was that the tension was not calibrated properly. So then that can happen. So what I try to fix this up by doing a single pass photopupiloplasty now, because I know that I have to make my pupil also central. It's not that I have to only correct the iris base. I cannot now release my iris base repair. So I have to fix up the iris, the center of the pupil, and try to make it centric, because this is a young patient. So having done that, having created this is my pre-op and the post-op image. It looks pretty good. The patient is a young traumatic case it was, and looks very nice. So this is how it settled down. So this was one of the things that I really wanted to highlight. Another important thing that I'd like to show you is that, for the repair, we usually use the hangback technique, which is described by Dr. Snyder. So many of the young people, they have this issue of engaging of the corneal tissue into the suture needle. So when you have that, what actually happens is that your suture does not slide back inside the eye. It gets engaged into the iris tissue, and your procedure entirely fails. So if you have to prevent that, you can place this Trokar. This we just published in one of the peer papers in the European journal. You can use this Trokar. You can guide your needle through this. If you are an amateur, and if you really do not, you're not very careful about how you're not engaging the corneal fibers inside the needle, then you can use this. If you're an expert, you need not do this. You can just go ahead and do a simple hang back technique, and you are all set. So this is again one complicated case. So I just wanted to show you how the application of Trokar works for the hang back procedure. So now you can just see how beautifully that loop slides back and it holds the iris tissue into place. And then you just again calibrate the tension before you tie the knot, calibrate the tension. That's a very big learning point in iris repair tissue, because that is what leads to retraction, or it leads to correctopia. So that you can just avert this. I'll just try to show you these are just animations which I'm just trying to show you for the clinical application. This is again a combination of hang back technique with single pass photoplasty procedure. It's a 2-4 technique. Initially, the iris repair was done with that, and then to have a pupil-centric, the central appropriate centration, we try to do and combine this with the single pass photoplasty procedure. Either procedure can be done. Either you can do a pupil-centric method first, or you can do the iris-based repair later. It all depends upon the clinical situation. This is another example where you have a big defect. You can close down the defect with single pass first, and then you can do a iridodialysis, hangback repair, and then you're all set for this. So these are various permutations and combinations that you can do, and these are some of the most useful methods in iris repair as of now. So I think I tried to cover how much I could. Thank you so much.